Quit Smoking for a Safer Surgery, a Health Communication Project proposal by Diamanda D. Murray, RN, BSN, RNFA, CNOR, Unit Director of Operating Room and Endoscopy at UPMC Altoona. This Health Communication Project proposal is intended to assist self-identified smokers who are scheduled for elective surgery to help them quit smoking prior to their surgical intervention. Research has shown that smoking cessation prior to surgery reduces the risks of circulatory, neurological, pulmonary, and wound healing complications. Written materials, online social support, and a combination of counseling and access to an online smoking cessation program from their operative surgeon are among the tools that will be utilized in this campaign. Approximately 19% of adults in the United States are identified smokers, and this increases their risk of complications while undergoing surgical procedures. A researcher team led by Schmidt in 2015 researched the impact of smoking on perioperative outcomes after major surgery and their 30-day postoperative risk, morbidity, and mortality rate. This study found that the effects of nicotine use were procedure-specific. Cardiovascular procedures undergone by current and former smokers had higher risk of negative outcomes. Another study by Singh, 2015, was a study that involved current tobacco use and the effect on implant revision and infections after total knee or hip replacement. This study included all patients who had undergone either total hip or knee replacement at the Mayo Clinic from 2010 to 2013. And results of this study included current tobacco use was associated with higher risk of implant failure requiring revision and also deep wound infection. These types of infections are very costly, both physically and financially. The goal for the Quit Smoking for a Safer Surgery Health Communication Project is to provide one-on-one counseling and formal smoking cessation education and tools to all self-identified adult smokers aged 55 and above who are scheduled for elective surgery at UPMC Altoona in either total joint arthroplasty of the hip or the knee or cardiac procedures. These two procedures of either the arthroplasty or cardiac surgery were chosen because those two surgeries were identified in the previous slide as having risk factors associated with smoking above and beyond what non-smokers have. There are three main objectives of the health communication campaign proposal. The first is that surgeons will counsel patients at the time of their preoperative visit about the risks of smoking and their impact on the surgical complications that they may encounter if they continue to smoke prior to surgery. The second objective is to provide written smoking cessation materials for the patient to refer back to after the discussion occurred at the surgical visit preoperatively. Another visit would encompass the surgical pre-testing visit. At this visit, the patient will be provided access to online tools for both social support and online smoking cessation program. The third objective is to review the patient's 30-day postoperative record for each identified patient who received the above tools in order to assess for any postoperative complications, specifically ones the research has shown to be associated with smoking cessation or lack thereof. The most important aspect of the Health Communication Project is the one-on-one counseling performed by the surgeon at the preoperative visit at the time that the surgery is scheduled. This is an opportunity for the surgeon to discuss with the patient the risks that are associated with smoking and how they impact the post-surgical recovery, as well as the overall benefits of quitting smoking for good. Studies have shown that direct communication is the best way to influence behavior if delivered by a trusted individual. Individualized communication is best suited for healthcare, and it does have the highest chance of success because it is tailored to the patient and allows for exchange of information and questions during that preoperative visit. Previously discussed smoking risk factors and surgical outcomes include heart attack, strokes, pulmonary and breathing issues, blood clots, wound healing issues, and surgical wound infections are the most common types of complications for patients who continue to smoke preoperatively. The effects of smoking on patients undergoing surgery, as described in previous slides, also has major economic and emotional impacts on the patient's family, and the community. Complications after surgery require additional treatments, medications, and recovery time, which translates to loss of income for patients and caregivers, as well as driving healthcare costs higher. Communities suffer when citizens are unable to be productive members of society, and they drain resources designated for health-related expenses, such as transportation to doctor's appointments and health services for community members who can't afford it. Tools provided to our identified patients in our health communication campaign would be information to help them stop smoking. And one of the ways in which we would do that is to offer them support groups, which are identified as being very beneficial to assist patients in stopping smoking. Mentors, health coaches, testimonials from current and former smokers are among those available on the Stop Smoking Center online support group. Although this group's focus is not specific to smoking cessation prior to surgery, the general support provided on this online support group would be applicable to this project's objectives. Among researched online support groups, we felt that this Stop Smoking Center would be the best opportunity for our patients to succeed. An additional online tool that we will be providing to our patients in the smoking cessation project is called ME Solutions. UPMC has purchased this product, which is a science-based approach to communication design, which allows patients to access information on a technology platform, tailoring that information to specific patient populations. In this instance, it would be for smoking cessation. These simple interactive modules explain healthcare issues at a 4th grade reading comprehension level. Patients are given an access code, and this will allow them to learn about their specific health issue or upcoming surgery. The surgical pre-testing appointment is a very crucial part of this health communication campaign. The patients are seen by an anesthesia provider, either a nurse practitioner or a certified registered nurse anesthetist, and that takes place at the surgical pre-testing department at UPMC Altoona. The purpose of this appointment is to assess any pre-surgical issues. Smoking cessation counseling by the anesthesia provider would also reinforce what the surgeon has already spoken to the patient about. Also at this site, the surgical pre-testing nurse will provide the patient the access code to the online ME Solutions smoking cessation program that we talked about in an earlier slide. This ME Solutions smoking cessation program is free of charge, as are all other ME Solution education modules. If the patient does not have access to the internet, and the patient population specifically to this program, because they're 55 and older, may not have the technological skill in order to access this information from Emmy Solutions. So we decided that we would be providing access and a tablet, laptop, whatever is easily navigable for these patients at the time of their surgical pre-testing appointment. And we provide, obviously, the surgical pre-testing department phone number for those patients who have questions after they leave, or if they would like to come back and utilize the Emmy Solutions program at a time other than their provided surgical pre-testing appointment. The final phase of our communication project will consist of the 30-day postoperative chart review, which will be performed by a registered nurse who will be specifically looking for any of those risk factors identified in the research as occurring to smokers versus non-smokers. Again, these complications would be anything cardiovascular, pulmonary, or anything to deal with wound healing or infection complication rates.